Feeling nervous in some social situations is normal. Giving a presentation, for example, may cause nervousness. In social anxiety, everyday interactions with someone cause anxiety, fear, self-consciousness, and embarrassment because you fear being judged negatively by others. Social anxiety causes severe stress, which can affect their daily routine, work, or school, or other activities. It is a chronic mental health condition, but learning coping skills in psychotherapy and taking medications can help you gain confidence and improve your ability to interact with others. Everyday nervousness, such as shyness or discomfort in certain situations, aren't necessarily signs of social anxiety disorder. Social anxiety disorder includes fear, anxiety, and avoidance that interfere with daily routine, work, or school, or other activities. It begins in the early to mid-teens, but it can start at younger children or in adults sometimes. Signs and symptoms of social anxiety disorder can include persistent fear of situations in which you may be judged, worrying about embarrassing or humiliating yourself, intense fear of interacting or talking with strangers, fear that others will notice that you look anxious, fear of physical symptoms that may cause you embarrassment, such as blushing, sweating, uh, trembling, or having a shaky voice, avoiding doing things or speaking to people out of fear of embarrassment, avoiding situations where you might be the center of attention, having anxiety or anticipation of a feared activity or event, enduring a social situation with intense fear or anxiety, spending time after a social situation analyzing your performance and identifying flaws in your interactions, and expecting the worst possible consequences from a negative experience during a social situation. For children, anxiety about interacting with adults or peers may be shown by crying, having temper tantrums, clinging, or parents or refusing to speak in social situations. Social anxiety occurs only during speaking and performance in public, but not in other types of social situations. Physical signs and symptoms can sometimes accompany social anxiety disorder and may include blushing, fast heartbeats, trembling, sweating, upset stomach or nausea, trouble catching your breath, dizziness or lightheadedness, feeling that your mind has gone blank, and muscle tension. Common everyday experiences that may be hard to endure when you have social anxiety disorder include interacting with unfamiliar people or strangers, attending parties or social gatherings, going to work or school, starting conversations, making eye contact, entering a room in which people are already seated, returning items to a store, eating in front of others, using a public restroom. Social anxiety may flare up if you're facing a lot of stress or demands. Avoiding situations that make you feel anxious may make you feel better in the short term, but if you take treatments, you may feel better in the long term. When social situations cause embarrassment, worry, or panic, it is preferable to visit your doctor or a mental health professional. Social anxiety disorder likely arises from a complex interactions of a biological and environmental factor. One of the causes is inherited traits. Anxiety disorder tends to run in families. It isn't clear on how much is it from genetics or how much is it from learned behavior. And brain structure. A structure in the brain called amygdala may play a role in controlling the fear response. People who have an overactive amygdala may have a heightened fear response, which causes increased anxiety in social situations. And finally, is environment. Social anxiety may be from a learned behavior, for example, developing social anxiety after an unpleasant or embarrassing social situation. Here's the amygdala, which is an important role has an important role in controlling your emotions and behavior, and it is best known for its role in fear processing.
It's a little orange circle in the brain
Yeah,
on the picture.
the blue amygdala. Several factors can increase the risk of developing social anxiety disorder, including family history. You're more likely to develop social anxiety disorder if your biological parents or siblings have the condition. And we talked about this in anxiety disorder and other diseases. It could be inherited. Negative experiences. Children who experience teasing, bullying, rejection, ridicule, or humiliation may be more prone to social anxiety disorder. And other negative events in life, such as family conflicts, trauma, or abuse, may be associated with social anxiety disorder. And temperament. Children who are shy, timid, withdrawn, or restrained when facing new situations or people may be at greater risk. New social or work demands. Social anxiety disorder symptoms typically start in the teenage years, but meeting new people, giving a speech in public, or making an important work presentation may trigger symptoms. Having an appearance or condition that draws attention. For example, facial disfigurement, stuttering, or tremors due to Parkinson's disease can increase feelings or self-consciousness and may trigger social anxiety disorder in some people. And Parkinson's disease is a progressive nervous system disorder that affects movements. The symptoms start with noticeable tremor in just one hand. Without treatment, anxieties can interfere with work, school, relationship, or enjoyment of life. Social anxiety disorder can cause low self-esteem, trouble being assertive, negative self-talk, hypersensitivity for autocriticism, poor social skills, isolation and difficult social relationships, low academic and employment achievement, substance abuse, such as drinking too much alcohol, and suicide or suicide attempts. Major depressive disorder and substance abuse problems often happens with anxiety social disorder, anxiety with social anxiety disorder. You can take steps to reduce the impact of symptoms if you're anxious. Get help early. Anxiety can be harder to treat if you wait. Keep a journal. Write your personal life in a journal book to keep track of your progress. This way, your mental health professional can identify what's causing you stress and what seems to help you feel better. Prioritize issues in your life. Managing your time and energy and doing things you enjoy can reduce the burden of anxiety. Avoid unhealthy substance use. Stay away from alcohol and drug use, and even caffeine or nicotine, because this can cause or worsen anxiety. If you're addicted to those things, quitting can make you anxious. See your doctor or find treatment program or support group to help you.
Okay. Just want to a bit of recap. Like social anxiety, everybody has some sort of social anxiety, especially when it comes to meeting new people. Just everyday social anxiety. Sometimes you don't want to talk to people because you might feel it's a bit awkward. So it's pretty common in people, but you don't want it to get to the level of a disorder. So yeah. How does your doctor diagnose if it's a disorder or not? First, they have a physical exam to assess whether any medical condition or medication may trigger symptoms of anxiety. Your doctor might also have a discussion of your symptoms. So the doctor says, "Oh, you share the person with the patient discusses his symptoms with the doctor and sees if the level is to the level of being diagnosed with a disorder. Review of a list of situations to see if they make you nervous. They hypothetically put them in certain situations and tell them what would your response would be. Self-report questionnaire about symptoms of social anxiety. They give you a questionnaire. Criteria listed in the diagnosis of material. Okay, so yeah, this there's a certain criteria. And if there's like a minimum number of things that you fall under in this criteria, you will be diagnosed with social anxiety disorder. And there's like this DSM-5. it's also apply. They do a lot of criteria for a lot of different diseases, but what the one that we're talking about is social anxiety. Next slide. Okay, this is the criteria that differs social anxiety, the normal everyday social anxiety that everybody gets, and social anxiety disorder. Persistent, if the anxiety is persistent, intense fear or anxiety about specific social situations because you believe you may be judged, embarrassed, or humiliated. Avoidance of anxiety producing social situations. Like for an example, let's say there's this person that you may know, but you haven't talked to him a lot for a while, say a year without talking to him, and then you see him in the mall, and then you just pretend that you don't see him just because you don't want to talk to him and put yourself in an awkward situation. That's a type of anxiety producing social situation. You don't want to meet him because you feel like it's going to be awkward and you're going to get anxious because of it, because you don't know how to talk to him. Just like that. Extensive anxiety that's out of proportion to the situation. I think that's pretty much self-explanatory. Anxiety or distress that interferes with your daily living. If the social anxiety that you have goes to the level that you can't do your everyday material, maybe you can't go to the shop because you don't want to look at the cashier in the eye. That's the type of social anxiety that intervenes with your daily life. Fear or anxiety that is not better explained by a medical condition, medication, or substance abuse. Yeah, that's pretty much self-explanatory. If the anxiety is not like connected to a medication or a specific substance that you use, alcohol or drugs, maybe this anxiety is a disorder that you have that needs to be fixed. Is everything clear, guys? Or any questions? So no questions. All right, next slide. Treatment. What is the possible treatment for social anxiety disorder? Just like many mental diseases that the mental diseases that we covered last week, the two main types of treatment is psychotherapy and medication, drugs, or both. They might use, like for an example, if the social anxiety is severe and it's reaching suicidal thoughts, they might use drugs to calm him down while the psychotherapy process is going through. So that's a way that both can be used at the same time. Next slide. Okay, psychotherapy. We talked about this. We have a really cool video that we want to show you at the end of the presentation. Psychotherapy improves symptoms in most people with social anxiety disorder. In therapy, you will learn how to recognize and change negative thoughts about yourself and develop skills to help you gain confidence in social situations. Basically, the doctor or the expert that is producing the psychotherapy is going to, through a lot of exercises and questions and conversations, help fix this situation. There's a lot of many methods, let's say. Cognitive behavioral therapy is the most effective type of psychotherapy for anxiety. It can be conducted individually or in groups. In exposure-based cognitive behavioral therapy, I think it was in the past presentations it was called this. I forgot what it was called exactly. But it's basically you expose the person with the things that we discussed in the phobias, to be exact. They expose the person with the thing that they fear, let's say, specific situations. Let's say a presentation in front of people. They expose him to that the situation, and through that they can he can overcome his fear and gain confidence in himself um, to talk. I think for most of us here, we had before, like let's say in elementary or middle school, nobody wants to talk in front of a large crowd. But if you do it once, let's say you embarrass yourself a bit, um, but then you learn from it, and then the next time you embarrass yourself a little, but not too much, and then you improve. What happens is in social anxiety, he gets so traumatized by one experience that he never wants to go again. And they do the exposure-based therapy, but gradually. They say first they do it with 5 people in attendance, and then they do it with 10, and then 15, and so on and so forth until he becomes confident in himself. Next slide.
And there are a lot of exposure-based cooperations, let's say, such as Toastmaster. You can go to Toastmaster to uh, help you do your presentations in front of others.
Yeah, training. Yeah.
Training.
And does it need to be actual therapy if it's not that much of a disorder? You just want to have better social skills. It's good to expose yourself to, let's say, kind of humiliating situations or experience, just to become more confident in yourself and say, "Oh, this is not so bad." Okay, first choice of medication. Those several types of medication are available. Selective serotonin reuptake inhibitors, SSRIs, are often the first type of drug used for persistent symptoms of social anxiety. This SSRI helps control the emotion response of the brain. Your doctor may prescribe these 2 drugs, Paxil and Zoloft, in some cases. Again, I want to rephrase the point that I don't like the use of drugs, mental disorders, unless it is a very severe case. The serotonin and norepinephrine uptake inhibitors, SNRIs, are also options for social anxiety disorder. To reduce the risk of side effects, your doctor may start a low dose medication and gradually increase your prescribed to full dose. Again, medications are still have the risk of addiction or reliability, and may not even fix the situation because they are part-time. The effect of the drug is going to run out now or never. Like it's a time, and then after that time, you're still going to be the same anxious person. So don't use drugs. Next slide. Other types of medications: antidepressants. We talked about this before. Anti-anxiety medication. Benzodiazepines. Thank you for putting the pronunciation. I really appreciate it. May reduce your level of anxiety. Although they often work quickly, they can be habit-forming and sedating. Making a drug use a habit is really bad because you don't know how to leave it. And if you leave it, you turn really anxious and really bad. So they're typically prescribed for only short-term use. Beta blockers. These medications work for blocking stimulating effects of epinephrine or adrenaline. Beta blockers, let's say you get really nervous in a situation. These beta blockers reduce the adrenaline hormone that's going in. And when you're getting stressed, you release a lot of adrenaline. These reduce the adrenaline, make you calm down. So hopefully reduce your heart rate, blood pressure, and pounding of the heart, shaking, voice and limbs. So you don't become so shaky. You're calm. I would say that these are typically used for important situations. Because of that, they may work best when used infrequently to control symptoms of particular situations, such as giving a speech. So let's say a person has to give a speech at a really big conference, and he's really stressed about it, doesn't know what to do. He may use these beta blockers to hopefully calm himself down. Next slide. Okay. Okay, so there's a lot of words here. Basically, what it's trying to say is the results of the process may not come in the beginning. It may take time until the person becomes more confident, depending on the severity of the disorder. So it may take several months, several weeks, depending on the situation, until it gets right. So you should the patient shouldn't be stressed or depressed if the thing doesn't work out in 1 or 2 weeks. It could take some time until the symptoms disappear. Next slide. Alternative medicine. There's a lot of herbal, and which means plants, herbs, remedies and supplements that can be used instead of the medications, which hopefully are more healthier than the drugs that are used. Next slide. Lifestyle and home remedies. These are the things that I like. Although social anxiety disorder requires help from medical experts, somebody can try to use these techniques to handle the situation, to not trigger symptoms. So everyday things that you can do in order to reduce social anxiety symptoms. Learn stress reduction techniques. You can do yoga if you want. I don't know. There's a lot of health reduction skills. I would say music is another stress reduction skill, or meditation, physical exercise, or being physically active on a normal basis. Get enough sleep. Eat healthy. Avoid alcohol. Limit caffeine. Caffeine increases your blood pressure, so it's might not be a really good thing. Although I drink a lot of caffeine. It's bad for you. Participate in social situations by reaching out to people with whom you feel comfortable. Okay, this is a good point. If you're comfortable talking to a person with in your everyday life, it's good to put yourself in social situations with this guy and train to not be so nervous. Next slide. Practice small steps. First, consider your fear to identify what situation causes the most anxiety. So I won't show the video, so I'm going quicker. If you're confused, please interrupt me and tell me. Please explain what's going on. There's practicing that you can do to that you reduce the symptoms. Eat with close relatives and friends, or acquaintances in public settings. Talk people that you're comfortable with. Put them in the situation that you fear the most. Basically, purposefully make eye contact and greet others. So people that you don't want to usually meet, you go and force yourself to meet them. So you get used to the situation and hopefully become more confident. Give someone a compliment. Self-explanatory. Ask a retail clerk to help you find an item. Maybe you're lost in a shop, you're looking for something exactly, but you don't want to talk to the person in the store because you don't want to get in an awkward situation. Go talk to them. Force yourself to go talk to them and see what things are like. Show an interest in others. Ask about their homes, grandchildren, hobbies. Basically know how to start the conversation. Call a friend to make plans. Next slide. Okay, just put the video because the rest of the slides are unnecessary, to be honest.
Open and support, what you can do, prepare for an appointment. Okay, let's watch the video. This is a video.
This is okay, go ahead, Rayan.
Okay, this video showing us a doctor that serves a client with the social anxiety disorder, and that's it. She uses the downward arrow technique to understand some of her underlying thoughts and beliefs.
Okay, so you said that when you're at work, you really worry that you're going to say something stupid.
Yeah, that's something that's always on my mind.
What would be so bad about that if you did say something stupid at work?
Because people would think I was weird.
Then what would be so bad if people at work thought you were weird?
They wouldn't want to be friends with me.
And what would be so bad about that if people at work didn't want to be friends with you?
Well, I just have no one to talk to at work.
Then what would be so bad about having no one to talk to at work?
I mean, the shoots can go on the whole day, so I'd just be by myself the whole time.
And what would be so bad about being by yourself, for a whole day?
I don't know, I guess I should be used to it now. I spend a lot of my time by myself. So.
Oh, that must be tough. What does that mean to you, that you spend a lot of time on your own?
I don't know, I guess it's just like I spend so much time by myself that it's kind of like I'm not even worth being friends with.
So it sounds like deep down that you think that you're not worth being friends with. And it's quite a negative belief. I mean, how much would you say that you believe that out of 100? If 100 is where you believe it totally and 0 is where you don't believe it at all?
I guess like 90 out of 100.
When did you start believing that?
I think it was probably at school. Yeah, I think at school.
And what was it about school that made you start to believe that you weren't worth being friends with?
Just like quite a lot of things. Like I wouldn't have anyone sit with at lunch, or like people's birthdays and stuff I wasn't invited, and like I was the last one picked for teams and stuff like that.
And what is it now that makes you think that that's still true?
I mean, it's kind of similar at work. Obviously, difference is that it's work, not school. But like people go for drinks and stuff after work or after a shoot, and I just kind of excluded a lot of the time.
That sounds tough. Is there anything that makes you think that it's not true, that you are worth being friends with?
I guess my friends and family would say that I am. Like I try to make a lot of time for my friends and stuff.
Okay, so it sounds like deep down you have this thought that you're not worth being friends with, and that started at school when you had trouble making friends at school, and that you weren't always picked for teams, and that now at work it feels like the same thing is happening, that you're not always invited out for drinks with people after work, and that sometimes you feel that you're excluded from their social groups. But then that's not the whole story, that on the other hand you are close to family and you do have friends who would say that it's not true, that you are worth being friends with. In CBT we do a thing called thought challenging, where when we have these negative thoughts, sometimes we actually put them up to scrutiny. We weigh up the evidence for and against them. I like to think of it as putting the thought on trial.
Okay.
Could we do that now, where we just actually try and weigh up the evidence for and against that thought a bit more?
Okay.
Okay. So if I just put 2 columns here, so for and against, and it sounds like the evidence for this thought that makes you think that it is true is difficulty at school, making friends, being picked for teams, and difficulty at work, feeling excluded sometimes from groups.
Yeah.
But actually in this other column, we have that you are close with your family and that you have some close friends. Now, moving back to this first column, is there anything else that makes you think it's true that you're not worth being friends with?
Just like I kind of don't go to a lot of stuff. People have like gatherings and things, and a lot of the time I don't go, and
Okay,
rather
so
just stay at home.
don't go to parties. What kind of parties are we talking? Like big parties, small parties?
Mainly big ones. If there's a lot of people there, I just find it kind of makes me really anxious. So a lot of the time I just prefer not even to be in that situation in the first place.
Okay, so you don't go to larger parties and events. Okay, is there anything else that maybe makes you think that it's not true, that actually you are worth being friends with?
I mean, I guess my friends would say that I was. I do have close friends, and when it's like their stuff that's important to them, I always make sure that I think about that, and even if I find it stressful, I'll always make sure that I can kind of put them first.
Okay, so your friends would say that you are worth it.
Yeah.
And it sounds like you put your friends first.
Yeah, I do make sure I try and do that.
In what kind of ways do you put your friends first?
I guess when it's birthdays or it's something important to them, I'll always make sure that I'm there and that I put a lot of thought into presents and stuff like that.
Can you give me an example of a time that you've done that?
It was my friend's birthday a few weeks ago, and we did like a big surprise at hers, and I made a cake and stuff like that.
So you actually help to organise events for your friends.
Yeah.
Is there anything that you do that you wouldn't do if you weren't a good friend?
I guess that I kind of always put myself in a situation, even if I find it it makes me anxious. If it's for my close friends and I know that it's something that's important to them, then I'll always put them first and make sure I'm there.
So you'll tolerate your anxiety if it means something to a friend of yours?
Yeah.
Okay, so at the moment in the 4 category, we've got that you had difficulty making friends at school, that you're having difficulty now at work making friends, and that you don't go to larger parties or events. But actually, there's a lot of evidence in the against column, evidence that would suggest that actually you are worth being friends with and you're a good friend, that you're close with your family, you're close with your friends. Your friends would say that you're a good friend. You put your friends first. Even when you're anxious, you tolerate that anxiety if you know it will mean something to them. That when things are important to your friends, like birthdays, you'll make a real effort. You'll even actually go to the effort of organising events and baking cakes and doing things like that for other people. Is there anything else that you do that makes you think that maybe you are a good friend, you are worth being friends with?
I mean, I still have my friends, so I guess if I wasn't worth being friends with, I wouldn't have these friends that I've had for quite a long time.
Okay, so it sounds like you've got long-term friendships as well, so that you might have trouble making friends, but when you make them, you stick with them.
Yeah.
Okay, I'm just going to give you this list now to have a look at.
Okay.
How do you feel now that you're looking at that list?
It's weird. There's actually kind of more stuff in the against than there is in the for. I guess also a lot of the stuff that is in the for column is kind of things that I make happen. Like I don't go to things. Yeah, it seems like some of it's kind of in my hands.
So it's not that you're not worth being friends with, but actually that you're choosing not to engage with people always.
Yeah, I think so. Yeah.
Okay. And if I was to ask you now, this idea that you're not worth being friends with, how much do you believe that now that we've done this exercise, where 100 is where you really believe that you're not worth being friends with, and 0 is that you don't believe it?
I guess I'd say maybe 40. I do still think that it might be true, but I think I believe it less than I did before.